Hello everyone. In this video we are going to talk about the joints and ligaments of the spine and thorax. The spine has two types of joints. One is the fake joint symphysis intervertebralis. This consists of facies intervertebralis, of two neighboring bones, and a discus intervertebralis. The 23 disci are stabilized by the ligamentum longitudinale anterior and posterior. The other type is the true joint articulatio zygaphyseales. To stabilize the articulation, there are the ligamentum flava, intertransversarium, interspinalis, and supraspinalis. Caudally, at the transition from lumbar spine to os sacrum and from os sacrum to os coccygeus, the joints are called symphysis lumbosacralis and symphysis sacrococcygea. The sacral vertebrae and coccygeal bones form a synostosis respectively, so that they are considered to be one bone. The ligaments and joints of the cranial spine has special features, which are caused by two things. One, the special structure of C2 and C1, or axis and atlas, and two, the transition of a spinal column to the occipital bone of the skull. This circle represents the foramen magnum. So we are in the skull and looking down through the foramen magnum on the atlas and axis with its dense axis. There are 5 joints in the craniocervical transition: articulatio atlantoaxialis on both sides, articulatio atlantoaxialis mediana, and articulatio atlantooccipitalis on both sides. The articular surfaces of the articulatio atlantoaxialis lateralis are called the same as the rest of the spine: facies articularis superior of axis and facies articularis inferior of atlas. The stabilizing ligaments are also the same as the rest of the spine. This changes in articulatio atlantoaxiale mediana. The articular surfaces are, of the C2, its facies articularis anterior and posterior, and of the C1, its fovea dentis and ligamentum transversum axis. The joint capsule encapsulates these articular surfaces. The anterior part is stabilized by the ligamentum atlantodentale, apicis dentis, and ligamenta alaria, and the posterior part by fasciculus longitudinale. Fasciculus longitudinale and ligamentum transversum together are called ligamentum cruciatum. Even though the articulatio atlantooccipitalis is considered a joint of the head and not a joint of the spine, I will talk about it in this video because its ligaments are similar in name to the ligaments of the spine. Now to the cranial continuation of the ligaments of the spine. The ligamentum longitudinale anterior continues as membrana atlantoaxialis anterior and membrana atlantooccipitale anterior. The ligamentum longitudinale posterior continues as membrana tectoria, which ends at the foramen magnum semicircularly around the ventral half of it. And the ligamentum flavum continues as membrana atlantoaxialis posterior and atlantooccipitalis posterior. The thoracic joints are formed by the junction of the ribs with the spine dorsally and sternum ventrally. Dorsally there are the articulatio costovertebralis capitis costae and costotransversaria, with ligamentum intraarticulare and ligamentum radiatum, as well as ligamentum costotransversaria and ligamentum lumbocostale. The articulatio sternocostalis is also stabilized by ligamentum intraarticulare and radiatum. Ribs 6 to 10 are connected to each other via the articulatio interchondralis, whose joint capsule is strengthened by ligamenta interchondralia. The connection of the cartilage part of the ribs with the bone part of the ribs, which in the drawing would be around here, is called synchondrosis costochondralis. The connection of the first rib with the incisura costalis of the sternum is also a synchondrosis, in contrast to the synovial joints of ribs 2 to 7 with the sternum. The manubrium and processus xiphoideus of the sternum are connected to the corpus of the sternum by a symphysis. And that was it for the joints and ligaments of the spine and trunk. Let me know in the comments if you have any questions or if something is unclear. Thanks for watching and see you next time.